I'm Dr. Brad Spiegel. I'm an interventional pain management specialist, and today we're going to talk about something a little different. It's called the Band-Aid. As corny as it sounds, but in seeing patients for 20 years, one question keeps coming up over and over again. Almost every patient asks me, "Hey doc, what we're going to do today, is it a Band-Aid? Is it just a patch? Is it something just to mask the pain, or are we actually going to do something to fix the pain or solve the problem?" And it's actually the latter. We're going to try and do everything we can to fix the problem or change something. We get a lot of pain patients, a lot of different diagnoses coming into the office, everything from cancer to pancreatitis. The most common probably is lower back pain or cervical pain, but today, for time, we're going to limit it to just one lower back pain. The most common reasons for the lower back pain are one of three things, and that is muscle spasms, disc problems, or arthritis or facet disease. Again, for time, we're going to limit it to someone coming in with just disc problem. They have a disc, maybe it's been out for a month or 2 months. Something's been out, either the disc is protruding or the disc is leaking, causing inflammation right around a nerve root. So if we have a disc in between, which are kind of like little bumpers in between the vertebral bodies, if it's pushing or touching or causing any inflammation around one of the roots, like here's L4-5, it causes pain. And the patients come in, they all say the same thing: I have lower back pain, it's radiating through my hip, I wish I could have somebody shove their finger deep into the hip and rub, but you can't get deep enough. And they can't get the pain to go away. If it's acute, if it's very early, sure, we'll do something conservative, some anti-inflammatories, and see if the swelling around the nerve root goes down on its own. If not, very often we'll do an epidural or do a selective nerve root. Instead of giving a patient steroids to the entire body by taking oral steroids, which gives you all the side effects of oral steroids, instead, we're going to put a little bit right to where the problem is. If we can get the swelling right around that nerve root to reduce even 1 millimeter or 2 millimeters, your pain goes away. Again, this is not a Band-Aid, but the goal is to try and reduce the swelling and make the patient pain-free, but and go on with their life. Once we make the patient pain-free or feeling much better, then we add on the multidisciplinary approach. We change other things in their lives, whatever precipitated the event. Reduction in weight, nutritional support or a consultation, biofeedback, exercise is really important. Anything we can do to try and keep the problem from coming back. Bottom line is, we're trying not to do a Band-Aid. We're trying to actually fix the problem so that they can go on with their life and go on and enjoy life, golf, tennis, whatever they like to do.